Good afternoon. Welcome to day 294 at the EMA office where we are bringing you the numbers on the COVID. Joined here with Chairman Mark Kern and Barb Hope from the Health Department. Barb, Happy New Year to you.
Happy New Year to you, gentlemen, everyone. Happy New Year. 2021 is here. Today's totals for St. Clair County, we have tested 209,560 to date. That's an increase of 1,712 since yesterday, and a large number of positives, 306 positives to report today since yesterday. Those are both males and females under 1 year of age to 90 years of age. That brings our daily St. Clair County positivity rate up to 17.9%. Our total negative tests were 188,400, and total deaths remain the same at a high number of 329. We had 19,134 folks that have completed the 10-day isolation period. Statewide, we have tested 13,374,665. That's with positive numbers of 970,590. That's an increase of 7,201 positive cases in the state since yesterday, and an alarming additional 157 deaths in the state of Illinois in the last 24 hours, for a total of 16,647 deaths due to COVID-related illness. Again, our sympathies go out to all those families and friends. Hospitalization numbers in St. Clair County hospitals, we have 104 COVID-related patients, and of those, 12 are on ventilators. And region-wise, we have 168 patients hospitalized due to COVID-related illness, and 16 of those are on ventilators. For congregate care living centers, a few additional cases. We have 3 additional cases at Mercy Rehab in Swansea, for a total of 121 cases and 9 deaths. Morningside of Shiloh, we have 2 additional cases for a total of 18 cases and 1 death. At St. Paul's Home, we have an additional 11 cases for a total of 143 cases and 20 deaths. And at Cedar Trails in Freeburg, we have an additional 12 cases with a total of 12 cases and 0 deaths. And in Freeburg, at Freeburg Care Center, we have 4 additional cases for a total of 70 cases and 2 deaths. Again, we have several COVID testing sites available throughout the week. Saturday, we will be at the Clair Fairgrounds to 8 to 4. Also, Saturday and Sunday, we'll be at McKendree University for a drive-through from 8 to 4 for COVID testing. Well, also Saturday and Sunday, we have testing from 8 to 4 at 4601 State Street in East St. Louis. Again, Monday, Tuesday, and Wednesday next week, we'll be at our St. Clair County Public Services building from 8 to 4. And then we have evening hours on Thursday from 10 to 6, and morning hours on Friday from 7 to 3 in the afternoon. And then again, next Saturday and Sunday, we'll be back at the fairgrounds on January 9th and 10th. All this information, again, is available on our EMA website as well as our health department website. So lots of testing available. Please be safe, and let's start out this year with a happy and healthy new year. Thank you. Chairman Kern?
Thanks, Barb. So we'll move into the zip codes. 62201 went up 8 today to 460. 62203 went up 4 to 511. 62204 down 2 to 324. 62205 up 3 to 519. 62206 up 6 to 1016. 62207 up 2 to 462. 62208 up 19 to 1,121, I think. That number's a little skewed on my paper. 62220 is up 19 to 1,455. 62221 up 28 to 2,024. 62223 up 25 to 1,283. 62225 up 3 to 103. 62226 up 35 to 2,304. 62232 up 4 to 681. 62239 up 1 to 327. 62243 up 22 to 518. 62254 up 7 to 618. 62257 is up 2 to 238. 62258 is up 11 to 764. 62260 up 12 to 530. 62264 up 1 to 248. 62269 up 48 today to 2,343. 62269 now is the by far the highest zip code in our county. 62285 is up 4 to 416, and 62289 up 2 to 41. Hot off the presses, 62208 is up 19 to 1,212. So we have 306 new positives today out of 1,712 tested, brings our daily county positivity to 17.9%. We put that in the rolling average category, and we now have a rolling average of 13.3%, and that's up 0.8 since yesterday. The state has not come in with their numbers yet today, so we're holding on to the regional positivity as of December 29th of 2020, when it was up to 12.7%. But what I will say is 306 is the worst day we've ever seen since we've been here for a one-day number. And if you count back those 7 days, we're about at Christmas. And so we have talked and talked and talked, and we had the medical community come on and encourage people to not gather, to wear their masks, wash their hands, and watch the social distance. And although hopefully it had an effect on some, obviously with the highest positivity day since we started this 294 days ago, we have work to do to try to educate those that just because a vaccine is available, it's not available in the quantities that are necessary to be able to immunize everyone in the county yet. And so we've got to continue to ward off the virus, do everything we can to have it not spread until we have enough vaccine that's out there for everyone. So we would encourage people to continue. Today's a new year, perhaps a good New Year's resolution for those who haven't been following those guidelines. Just embrace the mitigations now until we get to a point where the numbers get back to where we can open up again. That's below 6.5%. That seemed a pretty safe number that we were able to maintain and even get below for quite some time. Let's get there again. Let's work together. Let's pull together. The vaccine is already being distributed throughout the county to our emergency personnel, the first responders, the first line people who are taking care of us. It will eventually get out into the general population, but until that time, let's stop the spread. Let's slow the spread. Let's work together and try to keep these numbers below levels that like they are today. These historic highs that we hit like today do nothing but make it more difficult for our hospitals to be able to control and keep everyone healthy if they get in the hospital. Certainly to be able to make them better, it becomes more difficult the more crowded the hospitals are. Herb?
There's no prize for being the top numbers, and we've got to be low on that score sheet, and we're not doing that. I mean, the county positivity, went up from 9.7 to 17.9. Definitely in the wrong way, as you said, Chairman. We've talked about this all week. The fallout from the Christmas holiday. If this is any indication what we got to look forward to over the next 7 days to 14 days with New Year's Eve. And I got to say, there was a lot of pictures that I saw last night, a lot of phone calls that we got just today of places being open, people posting pictures of parties. it's a worrisome. And Team St. Clair, all of you have worked hard to get the word out there. And it's not your fault. It's just the people who just will not take this serious. And 157 more deaths, 57 deaths across the state of Illinois. We were lucky today not to start the new year off with the death here in the county, but we still got 329 of our citizens that we've lost. 133 people in the last 24 hours under the age of 40 tested positive. Every day we're getting calls more and more from families saying that, my nephew, my niece, or somebody is tested positive. What do we need to do? And, we keep telling them, and now they've tested positive, they have to quarantine. And I know the phone line at the health department has got to be burning up all the time with all those type of questions. And, that questions from businesses, when can they open back up? I hate to tell you, but if we don't get these numbers down and we don't stop this spread, if I'm a business person, I don't know if I'd want people coming in.
And it takes us so much longer to be able to get through this. We can shorten the duration of this whole pandemic if we can get these numbers down.
And we did it before.
And we can do it again.
And we can do it again. This is 2021, 294 days. You've been hearing us, and we'd love to say this was the last day, but we are going to be here until we don't have to be here anymore. So please, as the chairman said, let's do it together. There's not one person can do this. It's teamwork. We all have to take responsibility, each and every one of us. So let's start the new year off with a New Year's resolution that we're all going to work together to try to stop the spread of this invisible virus. As I said yesterday, we are all tired. We're all showing fatigue. But the one thing that isn't, and that's this virus that is continually knocking at our doors. And some of you aren't realizing that until it knocks on your door and it's got a member of your family that has been diagnosed with it. And then it spreads from there. And I know that's true because we've had people call and tell us that, when this started 200 and plus days ago, oh, we thought it was the flu. We thought it was a cold. We thought my son was just having a sniffle. Well, guess what? The son ended up having the flu. But he also then ended up got COVID. So it's out there. It's going to be there until we stop the spread of it, and we have to do that, and we can do that. So please, let's work together to do it. We'll be back momentarily with Daisy to translate this into our Spanish community. And once again, Happy New Year's to everybody, and let's all get on the same page, and let's stop the spread of this virus. Have a good evening.
I have battled this virus both professionally and personally. Professionally, I can tell you firsthand that it's greatly impacted our community, caused the loss of many lives, and continues to spread today. Personally, I can tell you that I contracted COVID-19, and it definitely is not the flu. This virus affects everyone differently, however, many have severe consequences. Please take this time to help your friends, your family, your neighbors, and the entire region by wearing a mask, washing your hands, and watching your distance. Together, we will overcome this invisible enemy.